Diabetes hides traps that can be fatal for the heart. Do you know the warning signs? Let's talk about the 4 most dangerous symptoms in diabetics, and we'll also discuss the 8 urgent medical emergencies that every diabetic should know about. Protect your heart. Subscribe to Health Dose and join us in the fight for a healthier life. The first dangerous symptom in diabetics that deserves our immediate attention is severe hypoglycemia, popularly known as low blood sugar. This condition occurs when blood glucose levels drop below normal, bringing along a series of potentially serious complications. From a medical standpoint, hypoglycemia is considered a medical emergency because the brain relies solely on glucose as a source of energy, and its scarcity can lead to irreversible brain damage. Symptoms of hypoglycemia can range from mild to severe, including trembling, cold sweats, palpitations, intense hunger, dizziness, mental confusion, and even loss of consciousness. What makes hypoglycemia particularly dangerous is how quickly these symptoms can escalate, requiring immediate intervention to prevent more serious consequences. Prompt treatment, usually involving the intake of a quick source of sugar, such as fruit juice or glucose tablets, is crucial to restore normal blood glucose levels and prevent further damage. The second alarming symptom in diabetics is diabetic ketoacidosis, a serious medical condition that arises when the body, due to insufficient insulin, begins to break down fats at an elevated rate, releasing an excessive amount of acids called ketones into the blood. This scenario can occur in both type 1 and type 2 diabetes, but it is more common in the former. Diabetic ketoacidosis is a critical manifestation of diabetes decompensation, which, if not treated quickly, can lead to diabetic coma or even be fatal. Symptoms include excessive thirst, frequent urination, nausea, vomiting, abdominal pain, rapid and deep breathing, and a distinct fruity odor on the breath, which is a classic sign of ketones' presence in the body. These signs indicate that the body is in a state of high acidity, which can seriously compromise the functioning of vital organs. Immediate treatment is essential and usually involves the administration of insulin, hydration, and correction of electrolyte imbalance, aiming to reverse metabolic acidity and restore the body's physiological balance. The third critical symptom in diabetics that cannot be ignored is diabetic foot syndrome. This condition represents a serious complication of diabetes and is characterized by a foot injury that does not heal or heals very slowly, which can lead to severe infections. Long-term, diabetes can cause nerve damage, diabetic neuropathy, which reduces sensitivity in the foot, causing cuts, scratches, or pressures to go unnoticed and consequently not receive proper treatment. Additionally, impaired blood flow in the lower limbs, another common consequence of poorly controlled diabetes, prevents sufficient nutrients and oxygen from reaching wounds to promote healing. Early identification and treatment of any foot wound are vital to prevent complications that may lead to the need for amputation. Warning signs include swelling, redness, warmth, and pain in the foot, even if sensitivity is decreased. Infections can develop rapidly and become severe if left untreated. Effective management of diabetic foot involves regular foot care, wearing appropriate footwear to reduce pressure, and medical follow-up for strict control of blood glucose levels, as well as immediate treatment of any wounds or signs of infection.
If what I shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health.
The fourth dangerous symptom that deserves attention in people with diabetes is blurred vision, which may indicate a condition called diabetic retinopathy. This complication is caused by damage to the blood vessels of the retina, the part of the eye responsible for capturing images. Over time, a high level of blood sugar can damage these vessels, causing leaks or abnormal growth of new vessels, directly affecting the quality of vision. Initially, diabetic retinopathy may not present symptoms or only lead to mild visual changes, but without proper treatment, it can progress to permanent vision loss. It is crucial for diabetics to undergo regular eye exams, as early detection and treatment can prevent the progression of diabetic retinopathy and vision loss. Changes in vision, such as blurred vision, spots or floating lines, and difficulty perceiving colors, are warning signs that should not be ignored. Treatment may include strict control of diabetes, medications to reduce swelling in the retina, laser procedures to seal damaged blood vessels, or surgery to remove leaked blood. The key to preserving ocular health in the face of diabetes is prevention and constant care. After exploring dangerous symptoms that may arise in the daily lives of those living with diabetes, it is crucial to turn our attention to emergency situations that require immediate action. These conditions not only represent a significant health risk but also require knowledge and preparation to be properly addressed. Beginning our journey through the 8 emergencies related to diabetes and prediabetes, the first on the list is severe hypoglycemia. Severe hypoglycemia occurs when blood glucose levels drop drastically, to the point of affecting the body's normal functioning. This can result in symptoms such as mental confusion, fainting, and in extreme cases, lead to coma. Unlike mild hypoglycemia, which can be corrected with the consumption of sugary foods or drinks, severe hypoglycemia often requires the administration of glucagon by injection or intravenously, with immediate medical intervention essential to restore blood glucose levels and prevent more serious consequences. The second medical emergency deserving immediate attention in people with diabetes or prediabetes is diabetic ketoacidosis. This serious scenario occurs when the body, in the absence of sufficient insulin to utilize glucose as energy, begins to break down fats at an accelerated rate, releasing a high level of acids known as ketones into the blood. This condition not only disrupts the body's pH balance, leading to acidosis, but can also cause severe dehydration, electrolyte imbalances, and if not promptly treated, result in coma or death. Diabetic ketoacidosis is more common in individuals with type 1 diabetes, but can also occur in some cases of type 2 diabetes, especially in situations of extreme stress for the body, such as infections or severe illnesses. Moving on to the third emergency, we encounter non-ketotic hyperosmolar hyperglycemic syndrome, NKHS, a condition that, although less common than ketoacidosis, poses an equally serious risk to individuals, mainly those with type 2 diabetes. NKHS is characterized by extremely high blood glucose levels, leading to profound dehydration and a significant increase in blood osmolality. Unlike ketoacidosis, there is no significant production of ketones, as there is enough insulin to prevent fat breakdown. However, the lack of effective insulin to process glucose results in severe symptoms such as confusion, lethargy, and in advanced cases, coma. Treatment involves intensive hydration, correction of electrolyte imbalances, and control of blood glucose levels, requiring immediate medical care to prevent potentially fatal complications. The fourth emergency we need to address is thrombosis, a condition that becomes more likely in people with diabetes due to the tendency for the hypercoagulable state to be exacerbated by hyperglycemia. Thrombosis occurs when a blood clot forms in one or more deep veins of the body, usually in the legs, causing pain, swelling, or even the release of this clot, which can travel to the lungs, causing a pulmonary embolism, a potentially fatal condition. The increased risk of clots in diabetics is linked to changes in blood composition and damage to the blood vessel wall, caused by elevated blood glucose levels. Prevention through glycemic control, as well as identification and immediate treatment of thrombosis signs, is crucial to avoid serious complications. Moving on, the fifth emergency is severe infection, a condition for which diabetics are particularly vulnerable. The immune system in people with diabetes is often compromised, making their ability to fight infections reduced. Additionally, a high glucose environment in the blood can promote the growth of bacteria and fungi, leading to infections that can become serious quickly. Urinary tract infections, pneumonia, and skin infections are common examples that can become medical emergencies if not promptly treated. Effective diabetes management, along with vigilance for signs of infection and immediate treatment, is essential to minimize the risk of serious complications from infections in individuals with diabetes. The sixth emergency in people with diabetes and prediabetes is lactic acidosis, a rare but serious condition that occurs when too much lactic acid accumulates in the body. This buildup can occur from the use of certain anti-diabetic medications, such as metformin, especially if there are kidney problems or dehydration. Lactic acidosis can also result from insufficient oxygenation in the body, resulting from severe heart or respiratory failure. Symptoms include rapid breathing, nausea, vomiting, and a sense of intense weakness. Without treatment, lactic acidosis can lead to shock, organ failure, and even death. Early diagnosis and medical intervention are essential to reverse this condition, emphasizing the importance of monitoring kidney function in people taking medications such as metformin. Moving on to the seventh emergency, we find diabetic macular edema, a complication of diabetic retinopathy, which affects vision. Macular edema occurs when fluid accumulates in the macula, the part of the eye responsible for clear central vision, causing swelling and blurred vision. This condition can progress rapidly and lead to vision loss if not treated in time. Contributing factors to the development of macular edema include inadequate glycemic control, high blood pressure, and progression of diabetic retinopathy. Treatment may involve intraocular injections of medications that reduce swelling, as well as laser therapy to seal leaks in damaged blood vessels. Early detection through regular eye exams is crucial to prevent vision loss in people with diabetes. The eighth emergency that completes our list is limb amputation due to complications of diabetic foot. When foot infections are not properly treated or timely, they can lead to gangrene to tissue death due to lack of blood supply. In severe cases, the only option to prevent the spread of infection may be amputation of the toe, foot, or even part of the leg. Diabetic foot is a serious condition resulting from the combination of neuropathy, loss of sensation, and poor circulation, making the feet highly susceptible to non-healing wounds and infections. Prevention through daily foot care, regular inspections to detect any problems early, and strict glycemic control are essential to avoid the development of complications that may lead to amputation. Thank you for watching this video. We hope the shared information can help you recognize and act upon these emergencies related to diabetes and prediabetes, protecting your health and well-being. Don't forget to subscribe to the Health Dose channel for more informative and up-to-date content on health and well-being. Your health is our priority. See you in the next video.